Good afternoon and welcome to DeLorean Artificial Intelligence. Today I want to talk to you about chronic kidney disease, end-stage renal failure, and artificial intelligence, or renal AI. Now, for some of you who have seen my other videos or follow some of the articles from DeLorean AI, we've been talking about real-time medical care management and the ability to predict disease onset and the transition from one disease state to the next. And we've also been talking about how there has been a flirtation with success of artificial intelligence and the medical community, especially healthcare payers. We've seen a lot of progress in claims processing and reducing costs, but we haven't seen a whole lot of improvement in actually improving the care for the end patient. So today we want to talk about renal AI. Okay, there is about 37 million Americans that have chronic kidney disease. Chronic kidney disease has 6 stages. It goes from stage 1, so an early stage of chronic kidney disease, all the way to stage 6, which is called N186 by the International Codes of Diseases, which is end-stage renal failure. Now, you might know those as those individuals or family members that are experiencing or going through dialysis, and there's a lower quality of life and it takes a lot of energy out of them. What if I could tell you that we could actually predict the disease onset or tell you if someone has the disease when they don't know about it? So out of those 37 million Americans that have chronic kidney disease, anywhere between 30 and 40% of them don't know they have it. What if we could predict that they have it? And the insurance company could easily send a message to them or their primary care physician to get checked or have a lab result test. And then they go to a nephrologist. What does this do? This allows not only the provider, so your physician or the nephrologist, but the member or patient and the health insurance company to have better choices for treatment modality earlier on. So the later you progress in the disease state, the less choices you have. In addition, Renal AI, our product, actually gives next best actions to slow down the disease progression or the transition. Now, 2 important precursor diseases for chronic kidney disease is cardiovascular disease and diabetes. And these 3 disease states are also improportionately higher in our African American populations. So the first thing I want to talk about is the ability to be able to predict that transition. Now, DeLorean AI's Renal AI product, we can predict the onset of the disease, and we can predict the transition from cardiovascular and also diabetes into it. So once the insurance companies and the providers or your physician know this, they can make better decisions and they can recommend those decisions so that we can treat the disease earlier. And that reduces cost, but also gives better health outcomes and better quality of life. Now, an interesting facet on this is for every single person that we can diagnose earlier, or let's take a population of 17,000. If we diagnose 1,700 or 10% of those, we would save $25.5 million US, as well as add 550 years of life saved and production or productivity for society. Now, how big is this market in terms of the disease, in terms of healthcare dollars? Well, the transition from cardiovascular disease into chronic kidney disease is about $20 billion per annum. Chronic kidney disease itself is approximately $82 billion. And only end-stage renal failure, so those people going through dialysis, is about $37 billion. So total up for the USA is $140 billion. You know, if we could take that and put that money in ways to actually treat the patients earlier on and extend their lives, how great would that be? So a recent study by DeLorean AI across 7 different providers, over 2 years, we were able to save almost $150 million in that, okay? And multiply that by thousands of years added to productivity to society. Now, the other thing we need to look at is, what are some of the technologies out there? Well, you have your traditional kidney companies like DaVita and Fresenius, and they don't have this capability. But you also have a new batch of companies such as Cricket Health and Monogram Health and Health Map Solutions who are bringing a new capability, a new direction to kidney care, inclusive of CVS as well. And they hope to use AI to be able to make the predictions that DeLorean AI already has. So I would highly encourage you to learn more about how AI impacts medical care in one of our other videos, which you'll see in the link. And I'd also encourage you to visit our website to learn more about our Renal AI product. Thank you for having me, and I look forward to making more videos for you to understand how healthcare and AI work together. Thank you.